So this is a really good initiative, and delighted to be able to support it because it gives real tangible information to young school leavers around what is a physiotherapist, what does a doctor do, where can I do dentistry, would it suit me, and rather than just rushing into courses on the basis of the number of points that they have from the previous CAO offering, that's about something that you want to do and that you feel that you'd be good at and that you'd make a career out of and that you'd be happy in. But the opportunities that are there now are enormous, and supported by the university sector, the ETBs and the second level schools. They are enormous. So if you don't get what it is that you want, it is not the end of the world. There are many other ways of achieving what you want to achieve that simply did not exist in the past, and there are always different ways and different angles to get into them. And what I would encourage people is to make sure that the constant contact that they have with career guidance, with their patrons, with the likes of Limerick and Clare ETB, these people are there to help you. That's what they're paid to do, that's their job. They will encourage you and they will support you in making sure that you achieve your full potential.
Well, we're absolutely delighted that an initiative that has started here locally for the benefit of students in transition year who wouldn't have had the opportunity to learn more about the exciting careers in health has now broadened its remit to the entire country, and we're just so delighted that over 17,000 students last year right across Ireland were able to access the very, very popular webinar feature with all of the fantastic content and information and interviews with people who are working in the healthcare areas, and we're just really, really thrilled about the fact that the students have these opportunities, because it's all about accessibility and making these options available to everybody in such a rich digitized format, which is enjoyable but also highly engaging as well.
So the website healthcareers.ie is really designed to support students and parents and teachers to find out any information they want about studying a career in health. So we have information from healthcare professionals who are working in the Midwest in acute hospitals and in community care. We have students from the University of Limerick and this year from the Technological University of the Shannon sharing their experience of what it's like to study health sciences and indeed to undertake that practical clinical experience where they get to meet patients and develop their skills. And we also really importantly showcase the voice of our patients, the people for whom we're always working in healthcare to serve. And the whole idea is that we can support our students to make informed choices around their career, what subjects they should take for their leaving cert, and all the different routes and options that there are to get into healthcare careers. Sometimes it's a direct entry from leaving cert, but oftentimes it can be a postgraduate after they've done a bit of exploration in another programme, and then they can come into healthcare. But either way, there's a wonderful career to be had in healthcare, hugely fulfilling, no day is the same, and indeed we really want to encourage our best and our brightest to all join in healthcare.
So in terms of progressing, I think the most important thing for students today to know is that there's a myriad of opportunities, and those opportunities didn't exist in the past. And those, in the past, the gateway was the leaving cert. You did it, you either repeated it or that was it. Your points were fixed, and you got into a course or not. That's no longer true. You've different opportunities as to how you get into programs. We have so many graduate programs. We have apprenticeships, and pathways of that kind. And so my advice to students is the most important thing is to pick a career where the subjects that actually intuitively are important to them. If they do that, they will flourish in those areas. And then if they don't get into the program of study first time around, just know that if that's something that they want to do, that ultimately they will end up there. And if they remain committed and passionate about their subject areas, they will end up in those careers because of the opportunities and the gateways that have been opened now.
Good morning, everyone. You are very welcome to the Junior Health Sciences Academy Early Careers event. In association with UL Hospitals, HSE Midwest Community Healthcare, University of Limerick, Limerick Education Support Centre, and LCETB. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host, Miriam McCarthy. Thank you.
Good morning, everybody, and thanks, Lauren. And you're very, very welcome to our day 2 of our Early Careers event. So hopefully some of you logged on Tuesday when we had our early careers event kicked off, and we had a really fabulous session with our social inclusion team, students from TUS and UL, and then a video following the journey of a patient having a heart attack. And if you haven't seen that, it'll be on our website in the next week or so. So we are really, really excited to be here for day 2, and we have a jam-packed day for health professionals and students from the University of Limerick, really speaking about their career in health and what it looks like, what a day in the life looks like. There's a couple of things I really wanted to draw your attention to today to make sure you get the most out of the session. So first and foremost, we build and create this in response to what you have said. So we do focus groups with transition year students every year to make sure that what we're delivering meets your needs. And in response to this, then we've created some videos for you for the first time to be shared today. So we're going to start off in a few minutes. We're going to have a video from one of our radiographers. I'm bringing you behind the doors of radiography, so you really get to see what that looks like. And we also have videos from speech and language therapy and physiotherapy following the journeys of patients, so you get a little bit more of an insight into seeing their role. This will be followed by a panel then with dietitian, social worker, medical scientist, and nursing. And I would really urge you, if you have any questions at all that you want to ask these staff, please pop them into the Q&A and we will do our best to answer them for you. This is then followed by a business and health section where you're going to hear from someone who works in finance and also operational services to understand a different side of healthcare, followed then by a panel discussion with students from the University of Limerick who are studying a variety of programs. So again, I'd really urge you, this is for you. Ask whatever questions you need to ask to get whatever clarity you need. 2 other things just to bring to your attention. We often know that you're here, you will hear this information. Gosh, I'd love to talk to somebody and maybe understand the roles a little bit more. Or I have questions and I'm not too sure how I can go about it. So next week, UL Open Days are on Thursday and Friday, and many of you, I'm sure, will be traveling to UL, but where we will be having a presence there at the open day. So there will be health professionals who will be giving talks and sessions around their career journey, their day in the life. It'll be in the main building and we'll have all the information on a slide at the end for you to capture. And do feel free to come up and chat. And, our purpose for this event is to help you to make informed choices around subjects, around careers, around sparking an interest and a curiosity in healthcare. Maybe there's careers that you've never heard of before, and after today and Tuesday's session, you might be a little bit more interested in or want to learn more about. One other thing just to share with you, we know there's a lot of information that's delivered over the 2 days, and we really want to support your learning through this. So on our website, healthcareers.ie, there's so many resources, but what's particularly valuable for today is a reflection tool that was developed by one of our partners in Castletroy College, one of the teachers, to support you in your learning on the event. So feel free to go onto the website, download the reflection tool, and there's a video of a student talking about the value of it as well. I'm really trying to, I suppose, for yourself, support your learning and what you've heard over today and the day before. So before we get started, I just want to say a quick thank you so much to the project team that delivered this with our colleagues from HSE Midwest and the University of Limerick. And particularly thank my colleague Verity, who's up next, who's part of my team, who's really done Trojan work to pull everything together for us over the last 2 days. And we are really, really grateful. So we know the students joining from all over the country, from the 4 provinces. There's thousands of you out there. So I really hope you have a wonderful morning. We're online until 11. And without further ado, I'm going to hand you over to Verity Hayes, who's going to take you through the first session. Thank you.
Great. Thank you so much, Miriam, and welcome to everybody. I'm absolutely delighted to be with you today to introduce the Healthcare Professional Speaker Series of today's event. We have 8 healthcare professionals from the hospital and the community settings are ready to showcase and give you a real insight into their profession. So as Miriam mentioned, in addition and building on feedback from you, the students, we have created 3 videos to visualize clinical settings. The 3 videos I'll be showcasing today would be radiography, speech and language therapy, and physiotherapy. Our first video today is radiography. So we're going to meet Grace O'Neill, who's a radiographer as well as a clinical practice tutor, and she is going to show us around the radiography department in University Hospital Limerick. So please type in any questions over the video, and we're going to have a lightning round Q&A with Grace after this. I hope you enjoy.
My name is Grace. I am one of the radiographers here in University Hospital Limerick, and I'm also a practice tutor, clinical educator here on site. I work with students all across Ireland and abroad for helping their education throughout once they're on site with us. So I'm going to show you around the department today and show you all the different types of equipment and procedures that we do. But first I want to explain a little bit about what a radiographer is. So as a radiographer, we're responsible for producing imaging to help you in your diagnosis for any issues that you might have. So we work with lots of different types of equipment in order to produce images from X-ray, CT, MRI, ultrasound, nuclear medicine, cath lab, theatre, down emergency department. We are involved in pretty much every area of the hospital, and our role is constantly evolving, so it's an exciting career to get involved in. Probably the most common types of images that we produce are chest X-rays and CT scans. And we do, I think last year, we did 52,000 chest X-rays, just chest X-rays in the hospital, in just the University Hospital Limerick, not any of the other hospitals that we're involved in. And we also did 10,000 CT head scans. They're probably the most common. So I'm going to show you how we do our chest X-rays. So like I said, we do over 52,000 chest X-rays, so we get quite good at them. So the radiation is produced in the tube just here, and then it's directed over towards the detector. And then it's detected by the detector and then sent onto the computer and then onto your file. So in order to make sure that we're pointing in the right direction, we use lights in order to show us exactly what's going to be irradiated. So we need to put someone in the middle, and we're going to use our lovely assistant Lita. And you're going to put your arms on the side, roll the shoulders forward, correctly positioned. You'll be taught all this in college, don't worry about it. And make sure that you're including everything that you need on there. Okay? So we use the radiation really specifically. So we don't want to over-irradiate. We want to make sure we're giving the right amount of radiation for what we need to see and no more. So it is part of the radiographer's role to reduce down the amount of radiation as possible, have the lowest dose possible. And then we go over to the screen, take the picture. We have to protect ourselves, so we go behind lead glass, and we take the picture, take the X-ray using the correct exposure factors, the correct amount of radiation. So welcome to the CT scanner. So this is one of our busiest areas. CT is really, really good for getting images really quickly on patients that are quite sick. So it sees everything, basically, everything that we need to see urgently, where blood goes, where it doesn't go, all of the bones, all of your organs. Very, very, very useful. One of the most common ones we do is a CT head. So in order to do a CT head, what we do is we put the patient on the table, and then we bring them up and in through the scanner. Then the scan is actually taken, it's actually X-rays that spin around and take the image in a big 3D block. It gives us a huge amount of information. It's super fast. This scanner, I think, takes less than 7 seconds to take over 400 slices, 400 pictures. The technology is advancing faster and faster every year. I can't keep up. But it is incredibly beneficial for seeing exactly what's wrong with the patient in a timely manner. So sometimes people get a bit confused between CT and MRI, and there is a big difference. However, the patient does go into a tube at the same time. Now, with the CT scan, we use X-rays, and like I said, quite a high dose of X-rays, but MRI actually uses magnetic pulses in order to get the signals to create the image. So it's a little bit easier to access CT than it is MRI because you can get 5 CT scans done in the time it takes 1 MRI to get done. So the waiting lists for an MRI scan are a lot longer than for a CT scan, as you might imagine. So there's lots of different types of imaging. When you first qualify, you are able to do general x-rays. Often they'll send you up to theatre. You'll get trained in first into interventional radiology and things like that. Now the next stage would be further training would be to get into cath lab, which is where we send you if you have any sort of heart attack, heart problems. And they provide a 24-hour service for people who have heart attacks suddenly in the middle of the night or anywhere. So we, as radiographers, also have an on-call service that provides that. We also go up to theatre, like I mentioned, and we're really involved in the orthopaedic theatres, urology theatres, and also a vascular theatre, which also provides an emergency service for the whole Midwestern area as well, and we are really involved in that as well. Then CT scans, MRI scans, and nuclear medicine scans are often training then after maybe 2 or 3 years of being a general radiographer. Like I mentioned, we've already spoken about CT and MRI, but nuclear medicine is a very interesting one. You get injected with a nuclear isotope and it travels around your body, and the patient themselves are the radioactive source. Then the patient lies down on the bed, and then cameras absorb the radiation, and we're able to see different things. It's actually an incredibly and really fast advancing modality or area of imaging that we are able to see. It's really interesting. Then further training will be needed to do things like mammography, which is for breast cancer screening, and also if you want to get into ultrasound, you'll need to do further training because it is highly skilled job with reporting involved as well. So, but ultrasound uses sound waves in order to bounce back information about different soft areas in the body. So it's really good for places like the livers, the kidneys, spleens, also really good for obstetrics, which is babies, gynae stuff, all sorts of like women reproductive systems and male reproductive systems as well. We offer imaging 24/7, 365 days a year as an on-call basis. It offers a lot of flexibility with our lives, but also offers a lot of opportunity to be there in the most vital moment of a person's life. So I hope you've enjoyed coming around the department and visiting us today, and we really hope you consider a career in radiography.
Grace, how are you today? So
Hi.
Grace is our radiographer and clinical practice tutor from University Hospital Limerick. So in that video, you give a really good kind of career in radiography kind of overview. But what I wanted to know from you is about your education journey to become a radiographer. Would you be able to give us a couple of minutes on that, please, Grace?
Yeah, sure. So I kind of came to radiography a little bit unorthodox because it's kind of one of those careers that you're not really aware of. People know about nursing, medicine, physio, but radiography is kind of one of those things you kind of have to know somebody in it to be like, oh, really? Is that what you do? So I did a kind of a broad spectrum leaving cert because I wasn't sure what I wanted to do. So I did physics, fine art, and geography. And I did French as well, in English Irish maths. I actually did I did honors maths, and I did pass Irish because I was like I knew that I needed to kind of focus more on the sciences. But then I ended up going to art college. So
Okay.
And then I decided I was working in the hospital as a care assistant as a part-time job. And I looked around and I was like, what could I do that is guaranteed money, a nice job, and it is kind of creative as well. So I saw radiography as a really interesting opportunity to like have sort of like communication with patients, but also dealing with kind of really interesting machinery, problem solving, getting nice images and getting diagnostic images for the radiologists and the clinical teams to make decisions.
Do you actually read and write reports?
So what we do is in certain aspects we do. So so there's further training that goes on past the 4-year course in UCD and in other areas. And unfortunately, UL doesn't have a radiography course yet, but there's a master's course in ultrasonography where we do write reports, and that responsibility is on us. However, most of our responsibility is in order to make sure that the images are diagnostic, to make sure that the radiologists have read them. So a radiographer is a photographer, we create the imaging, and a radiologist is the doctor.
Okay, got you.
They are responsible for writing the reports, communicating with the team, and deciding on what to do with the patient. So we're kind of in the middle there. It's quite a nice little space to be in.
In your education, it's good to hear like you don't need to know what you want to do by, fifth or sixth. Yeah, absolutely. So, but when did you know that radiography was the career for you?
I think it was when I first started on placement. I think on placement, that's when I really realized, oh, this is it now. Actually, this is something I could really get my teeth into. And I think as well, I work with a lot of the students. I'm the practice tutor for all the students that come on site into UHL. And I was asking them, how did you decide to do radiography? And a lot of them were basically like, I knew somebody who did it, and they said it was a really nice job. And I really liked the aspect of working with people, but also technology. So that was really interesting.
It's interesting, isn't it?
Concept. And a lot of those, I asked them about their leaving certs as well, because I think people here would be interested in that. Most people did biology. I never did.
Okay.
But I think that would have been very beneficial for me. And
good.
A lot of people did chemistry because they were a little bit scared of physics. Now, there is physics in the course, but it is not a scary type of physics. It's more practical physics.
Okay.
And it's a very limited part of the course, but it is something that you do need to consider, that you do need to be happy to learn, but it is reasonable. It's very reasonable. It's very practical applied physics.
Yes. Okay. And what other subjects would you recommend that would be helpful? For when you actually
honestly, I think biology probably is the most useful one.
Okay.
So you've got your anatomy in there, and you kind of start understanding a little bit of reproductive health is actually very important for radiography as well, because that's very important for radiation. But I think do what you feel like you want to do. Just make sure you have some of the sciences in there, because then they'll be accepted.
Okay.
As it's a system in Ireland, we are a little bit limited. Like I've had some people come in who've done like ag sciences, geography, like they're all classed as science subjects as well. But usefulness, I would say maybe definitely biology, and definitely if you try and do physics, chemistry wasn't really any use. I have to say, but it often is chosen to do because it's seen as a little bit easier to do than physics, but I never did it, so I don't know.
So part of so as a radiographer, you've also got a second job as well, which is a clinical practice tutor. So you're there to support students. I'd love to hear about that. So when students get into radiography, they're in their course, and then they start doing placement, what kind of support do you give them when they're on site?
So I work full time with the students, but most of the what I do is I enable students to get out there and start working with patients immediately, straight on. I encourage them to get more confident in their skills. I encourage them I work one-to-one with them. Each one, I have about 8 students, but I think they're thinking of increasing it to like 13 students across the sites. So it is growing. It is growing quite fast. But yeah, my role is basically supporting them. I also do assessments on to see if they're capable, to see if they've learned enough. I also do a lot of
Great.
assessments up in theatre, CT, lots of different things. So there's a lot of different competencies that they have to fill out during placement. But my job is mostly to encourage them to take responsibility, to be diligent in their work, and to ensure that they know the effect of the radiographer on the patient's flow through and on their care throughout. That's my job.
That's great. And for a student, it's really reassuring to know that you're actually on site with them. You know, is it for a 2-year placement? Is it so you're there for their support
No,
for 2 years?
It's for the whole four years.
Great.
So they come out for 4 weeks in first year, for 4 weeks in second year, for 10 weeks in third year, and then for 14 weeks in fourth year. So they're currently undergoing some changes, but yeah, honestly, the most you learn from the course is on placement, because it's hands-on and you have to learn it. So I find I'm the practical tutor. I'm not an academic tutor.
Yes, that's it. Thank you so much, Grace. In the next video, we're going to travel to St. Camillus's Hospital in Limerick, and we're going to meet with Una Dean. So Una Dean is a clinical specialist speech and language therapist, and you are going to watch a real-life fees assessment. A fees assessment is a fiberoptic endoscopic evaluation of swallowing. We're going to have Una back as part of our Q&A panel, and I hope you enjoy the video.
Hello, my name is Una Dean. I'm a clinical specialist speech and language therapist working in community services in the Midwest region. I'm going to tell you and show you a little bit about what we do. Speech and language therapists, or SLTs, provide assessment, treatment, support or care for people of all ages who have difficulties with communication or swallowing. I specialise in working with adults with voice, throat and swallowing difficulties who are seen in a new clinic in University Hospital Limerick. This clinic is part of a new exciting service called the Ear, Nose and Throat Modernised Care Pathway, where we see people who've been referred to the hospital with a concern about their voice or throat. SLTs often work closely with other health professionals such as doctors, nurses, physios, occupational therapists and dietitians to develop individualised treatment programs. Working with all of these teams is really important to ensure our patients do well. I decided to study speech and language therapy as I was interested in a career in healthcare involving communication that would give me choices around working with adults or children, in hospitals or out in the community. But when I graduated, I decided to work with adults. In adult SLT, we work with people who have had strokes, traumatic brain injuries, cancer of the mouth or throat, neurological conditions such as Parkinson's disease, or changes related to aging such as Alzheimer's dementia. Since qualifying, I have worked in hospitals, community settings and also in the University of Limerick. But SLTs are important in all parts of the healthcare system. We can work in every part of the hospital, from the stroke unit to the intensive care unit. But in the community, we're often based in healthcare centres, although we often visit people in their own homes too. SLTs work in different community teams, such as rehabilitation, older person frailty services, or in mental health services. When an SLT gets a new referral, we initially gather as much information as possible from the person themselves, their family, their GP, or by requesting reports from other professionals. Then we assess the person to diagnose their problem. This might involve gathering a more detailed case history, conducting standardised assessment, or more in-depth testing using technology to investigate their voice and swallowing. In the Midwest, we are the first community SLT team outside the hospital setting to use FEES, an objective swallowing assessment that you will see demonstrated shortly. We pass a camera through the nose into the throat and this allows us to view and examine the inside of the throat to see how the muscles are working. While the camera is in place, we ask the person to eat and drink. We can see if food or drink goes down the wrong way into the lungs or sticks in the throat. We try different strategies to help during the assessment, and then we recommend what the person can safely eat and drink, as well as exercises that will help improve their swallow.
Today we're going to see if Niamh is having any issues with her swallow. We're going to do an assessment called FEES, where we pass a camera, like the one in this image, through the nose and down into the throat to watch her swallow. This will tell us if food or drink is entering the windpipe or trachea, sticking in the throat, or going safely down the food pipe or esophagus.
So this is our FEES stack. I'm going to insert the scope into Niamh's nose to assess her swallowing. Good. Okay, and just take one more drink. Good. So that looks really good, Niamh.
We just saw a normal swallow, where nothing went down the wrong way. Looking at these images, on the left you can see the airway labelled 6, the vocal cords labelled 5, the arytenoid cartilage labelled 2 and the epiglottis labelled 3. During swallowing, all of these close to protect the airway. In the image on the right, the area in red shows where food or drink would have gone down into the airway or been left behind in the areas marked purple and green. These would have shown a swallowing problem, and we would have prescribed exercises or strategies to help the swallow improve.
Every day is different. Our profession is developing and changing. We're offering new and better treatments to people with communication and swallowing difficulties. Thinking about my role at the moment, specialising in voice. When you think about what it would be like to lose your voice or not be able to rely on it, you can see how important our job is. I hope you've enjoyed hearing about and seeing a little of what we do in speech and language therapy, and I hope it sparked some curiosity. It might be something you want to consider studying, and if you do, get in touch.
Thank you very much, Una, and we're going to have Una back as part of our panel discussion at the end. For our final video, we're going to meet with Claire Eigel. Claire is a senior physiotherapist who works for a multidisciplinary community intervention team. We will visit the Thurles Primary Care Centre, the physio gym, and then travel to a patient's home to give you some insight of treatment within the community.
Hi, I'm Claire Eigel, a senior physiotherapist on the multidisciplinary community intervention team. Our team is a community-based rehab team that provides therapy in the home for people on discharge from hospital. We would have 2 physiotherapists, an occupational therapist, a physiotherapy assistant, and there are also community nurses and healthcare assistants available on the team. The goal of the team would be to get people home from hospital quicker with the support in their home and the therapy that they need to make them as independent and improve their quality of life. We get a range of clients referred to us from the acute hospitals and also from the emergency departments. We would see mostly older adults, mostly a lot would be over 75, many fallers, fractures, some fractured hips, pelvises, spines, then clients who've been admitted with any range of medical conditions who've become deconditioned or just weaker while they're in hospital, and they're hoping to get back to their usual level of independence. So we would work closely with the occupational therapists. They can provide some equipment to help to make a person more independent in their home. And we would practice practical things like it could be mobilizing around the home, practicing transfers such as on and off the bed, on and off a toilet, on and off a chair. We would provide mobility equipment or aids if needed. Outdoor mobility is often important to people.
There's stairs. Sometimes people have to move downstairs when they go home from hospital, but they may want to be able to return back upstairs. And we would work closely with our team members to improve people's quality of life and independence. Okay, we're now in Thurles Primary Care Centre, and this is the physio gym. I'm going to bring in a client who's recently had their have had hip surgery for a hip fracture, and we're going to do some exercises here in the gym. Okay, Joan, so you're a few weeks after your fractured hip, doing really well, and now we're going to practice the stairs. So what we're going to do today is you're going to hold on with both hands to start with. You're going to walk to the top here. At the top we'll turn around and we'll come back down the same way, okay? There's an easier way to do it, and that would involve, on the way up, going up with your non-operated leg first, and then bringing the two legs onto the first step, and subsequently the same. Okay, so start with your non-operated leg. Well done. Put your feet right onto the step. Turn around, hold on with both hands here, and you're going to come down with the operated leg. Well done. And one more. Joan, we're going to practice walking around these cones with the crutch now. So if you can stand up there, use your two hands to stand up, pop your right hand into the crutch, and I'll just get you just to walk through the cones and back. Okay? Yeah, move on the side. Okay, well done. Well done. You can get back to the chair now. Make sure the chair is behind you. Can you feel the chair behind you?
Yeah.
Take your hands out of the crutch and reach back and sit down. Well done. Okay, Jill. So to try and improve your hip strength and movement, I'm going to get you to walk up and down over the hurdles. So you can hold on to the two bars and just step over the hurdles all the way to the top and back. Well done. Turn around there and all the way back. Really good, and you can just take a seat there. We're now going to go and see a client out in her home, Mary, who's recently discharged from hospital. We're going to work on improving her strength and a bit mobility in the home. Okay, Mary, we're just going to do your exercises now. So I want you to do the first one is up and down on your tippy toes 5 times. 1, 2, 3, 4, 5. Excellent. Now you just take a break and we're going to do the hip exercise. So bringing your right leg out to the side and back in 5 times. 1, 2, 3, 4, 5. And you're just going to hover your hands over the top of the counter for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Excellent. And okay, so Mary, this time we're going to work the arm muscles and the shoulders. So I want you just to lift the tin of beans up over your head, stretch it towards the ceiling and back down, and we'll do 10 of those. So off you go. 1, 2, as high up as you can go now, straighten that elbow out. 3, 4, really try and straighten the elbow. 5, 6, 7, 8, 9, 10, and then you can swap over. Don't forget to breathe now. For later. So now you're going to work the legs and the thigh muscles by doing some standing up and sitting down, like your squats, okay? So I want you to stand up fully and then sit back down fully. Up and down. And we're going to do 5 of these. 2, well done. 3. During the walk, we'll walk into you push up on the arms of the chair now.
Oh yeah.
Okay, so up you get. Remember now you've got your brakes to deal with there, so take the brakes off and we're going to walk into the sitting room. Yeah. And take your time now and just stay nice and safe. Part of this role, which is slightly different in my experience, is that We would link in with different community services to try and enhance a person's quality of life. It could be organising meals on wheels for somebody, giving them the contact to organise a pendant alarm, linking them up with their local day centre or activity groups, maybe trying to organise some more home support for them. Anything really that's available in the community that might enhance their well-being. Hopefully you've learned something useful today, and it might have sparked some interest in physiotherapy or other healthcare professionals.
I hope everyone enjoyed the physiotherapy video. Now I'm going to invite the 7 healthcare professionals back on stage, and we're going to have a group Q&A. So keep your questions coming in. I'd like to introduce Killian Custy, who is a community dietitian. Valerie Switzer, who's a senior clinical psychologist. We've got Aoife Waters, who is a community social worker. We've got Anna Poe, who is a medical scientist. John McCarthy, who is a clinical nurse specialist. Una Dean, who is a clinical specialist speech and language therapist, as well as Claire Eigel, who is a senior physiotherapist. Hi, everybody. How are you?
Hi, everybody.
Morning. Very good.
Morning, everyone.
Hi, everybody. So at first, we're going to go to Una Dean. So Una, we did a fabulous video on speech and language therapy and seeing a FEES procedure done, which is going to be up on our website, okay, after this directly. So www.healthcareers.ie. So we do urge anyone interested in speech and language therapy to go and view that. So you, in your video, okay, you give a really good indication of speech and language therapy in the community. I wanted to know, when you were completing your CAO form, did you know that speech and language therapy was the career for you, or how did you come to that decision?
Thanks, Verity. So I wasn't sure at all about what I wanted to do. And nobody in my family had pursued a career in healthcare before. But there was something about it that appealed. What aspect of healthcare, I wasn't really sure. But I had an interest in languages. I definitely like talking. I thought that speech and language therapy was something I should look into. So I looked into the course. There was only one course available in Ireland at the time, and that was in Dublin. I looked into the subjects. I hedged my bets with my subject choices, but then I went and shadowed a speech and language therapist and decided that it was definitely something I wanted to try.
And Una, just give us a brief overview of what a speech and language therapist is.
So a speech and language therapist looks after children and adults from babies to very old age with communication and swallowing difficulties. So the communication difficulties, we know that children might have difficulties with their speech and their language, but in adults, where I've chosen to specialise, we work with people who have strokes, Parkinson's disease, which might change their swallowing and their speech. We would work with people who have cancers of the mouth and throat. And we would work with people after traumatic brain injuries who have a problem with their speech, language and thinking, and often their swallows as well. So really we assess to find out what the problem is and then work with the patient to bring them as close as possible to their goals.
Oh, fabulous. Thanks, Una. I've got a few more questions with you. We'll come back to you if that's okay. Claire, thank you for joining us today. Would you like to introduce yourself and just give us a brief description of your current role?
Yeah, I'm Claire Eigel, Senior Physiotherapist. I'm on the multidisciplinary community intervention team. So I work in a community setting. We would receive referrals from the acute hospitals and the emergency departments. I'm on a team with an occupational therapist, a physio assistant, nurses and carers as well. And our role would be, well, my role would be to visit somebody within 24, 48 hours after they come home from hospital and try and improve their independence and function, get them back to their usual level of function, and work with the other people on the team. So traveling around a lot,
And Claire, have you worked in acute settings, when I mean acute, like hospital settings as well as the community?
Yeah, so I'm over 20 years of physio. I have had various jobs. I worked in Scotland for about a year and a half, doing in an acute hospital doing rotations. So rotations is when you move maybe from one area of physio to another. So you might do 3 months maybe in orthopedics, and then you might do 3 months in an ICU, or you could be doing pediatrics for 3 months. And anyway, that's a really good experience when you start out. So I did that in various hospitals in Scotland, then came back to Dublin and worked in St. Vincent's University Hospital for a few years, and then Tala as well. And then they were all acute hospitals, getting different bits of experience. And you can then go from being a junior physio or basic grade physio to acting senior and senior posts. And then I've worked in nursing homes a little bit, manual handling trainer, and now then back to primary care, which is working with outpatients in the community, and then this team is more community based. Yeah.
Oh, fabulous. I've got a few questions to ask on that later, but we'll go to Aoife Waters. So Aoife, would you like to introduce yourself and give us an indication of what role you're in at the moment?
Sure, thanks, Verity. So my name is Aoife. I'm a social worker working in the community in a primary care team at the moment. So as Claire has mentioned there, a primary care team is a team of a mixed group of professionals that work out in the community. I suppose delivering probably the healthcare and social care, you know, at a local level to people. So as part of that, I suppose I would do a lot of work in people's own houses and own homes. I visit people at home mostly, and I'm working alongside.
By local, Aoife?
Yes, exactly. So I suppose it's their own, trying to deliver healthcare within their own, I suppose, local area, which is the first tier really of healthcare. Always working hard, I suppose, to try and support people to live independently at home in the way that they want to live, and kind of overcoming maybe any obstacles that are there that might block them in terms of living well. So that's why there's a social worker on the primary care team, because that's my job to work on those pieces. Yeah.
Great. Thank you very much, Aoife. Anna, if you'd like to unmute. Thank you.
Hello.
Anna, you're very welcome.
Thank you.
I'd just like you to introduce yourself and let everyone know, as a medical scientist, your position at the moment.
Yeah, so hi everyone. I am a medical scientist in the blood transfusion laboratory here in UL Hospitals Group. And I suppose as a medical scientist, we work in partnership with lots of clinicians, doctors, nurses, and about 60 to 70% of clinical decisions are made from lab test results. So I suppose that's the importance of our job in the background.
Oh, absolutely, Anna. And as a medical scientist, what struck me is that you're probably one of the healthcare professionals that, you know, doesn't work with patients in a sense. How does that kind of work with your role? Do you work in a big team, or could you talk us through that, please?
Absolutely. So as a medical scientist, I suppose it's important to be able to work independently when it is time to start on-call shifts, I suppose, but also be a key team player and have those effective communication skills. So we don't see the patient face-to-face or directly, but we are part of the patient's journey, and again, providing the details and I suppose the information for the clinicians to make those decisions.
Great. And I can't wait to hear more from you. We're going to go to John McCarthy next. John, would you like to introduce yourself? Hi, John, and give us an overview on your role.
John McCarthy is my name, and I work with the Infection Prevention and Control team for University of Limerick Hospital Group, 5 hospitals. We, much like what Anna was saying there, we kind of work in the background, but we're very involved in the patient journey through the hospital. We deal largely with what you could term, I suppose, is the unseen. We deal with the bugs. We deal with those little guys that can make people very sick, the patients and the staff. So really, in a nutshell, what we do is we educate, we equip our staff with the skills and the knowledge to manage infections, individual infections and perhaps larger outbreaks across the hospital group. And we also work with basically everybody on screen here as well to equip them with those skills. And we at times as well do intervene with patients to speak with them about their infections. Again, it's all education, it's all audit, and just being on site in the background, keeping everything safe from that side.
So originally your background's in nursing, you're a clinical nurse specialist now, which is kind of more senior role. But take us back to your career journey. Do you want to give us a little bit of insight of becoming a nurse, etc., to how you got to where you are now?
How far back do you want me to go?
Well, let's go back to your 5th, 6th. Yeah, go on.
when I was conscious, I suppose, of the fact that most people listening into this call today are transition years, fifth years, sixth years. Back when I was at that stage, I had really no idea what I wanted to do, none whatsoever. You know, there was no career pathway on a shelf in a box somewhere that I was going to select and be happy with for the rest of my life. I studied a course in UCC well over 20 years ago, again, science-based, but at the opposite end of the spectrum to nursing. Finished that, ended up getting a job in a hospital, my local hospital in Mallow, as I suppose, a hybrid between a healthcare assistant, and I worked in various departments around the hospital, X-ray, theatre, even the kitchens at some stage. So it exposed me a lot to what happens in a hospital. And I can remember as a healthcare assistant one night, one spring morning actually, looking out the upstairs window at Mallow General Hospital at the time, just deciding, a light bulb moment, I know there's more to this. So I decided at that moment, I'm going to be a nurse. And that was well over 20 years ago, 24 years ago, actually. Yeah.
Wow. Wow.
Yeah.
What age were you when that light bulb moment kind of
I
realized?
really don't want to give away my
No,
age,
that's fair.
but I would say, had I hit 21, yes, 21, 22 years of age, yeah.
And do you think having a little bit of experience, like we've heard it from Grace as well, to kind of working as a healthcare professional in that, just getting a bit of an experience on the hospital kind of setting, that gave you a bit more kind of clarity
not everybody listening in today that might be considering a career in nursing will have that exposure to work in a hospital environment. If you know nursing is for you right now, that's a great help. You might not. So reach out. Nearly everybody knows a nurse, nearly everybody knows a physio, you know, a social care worker, or somebody that knows somebody that works in healthcare. Reach out to them, talk to them. It helps an awful lot.
Yes.
Find out what it's actually like, you know.
Very good advice, John. We're going to come back to you, okay? I'm going to introduce now Dr. Valerie Switzer, who's our senior clinical psychologist. Hi, Valerie. How are you?
Good morning, Verity.
Would you like to just introduce yourself and give us a bit of an overview of your role?
Sure. So my name is Dr. Valerie Switzer. I'm the senior clinical psychologist in the Department of Liaison Psychiatry here in University Hospital Limerick. So alongside psychiatry and mental health nursing, we provide a service to the general hospital in respect of people's mental health needs. And as the psychologist on the team, my focus is really on helping patients manage the emotional and the psychological fallout of physical illness, injury, and disease. Okay. So sometimes that's helping somebody to recover from an acute event like a heart attack, and other times it's about helping somebody who's been diagnosed with a chronic disease where they're not going to get better, and it's about helping them live the best life they can despite the symptoms.
Excellent. And can you tell us just the difference between a psychologist and a clinical psychologist? I know that just break it down for us, please.
Sure. So a clinical psychologist is somebody who's done a postgraduate professional qualification in an applied area of psychology. So specifically, our expertise would be in the area of mental health. A psychologist is somebody who's maybe completed an undergraduate degree in psychology. So at this moment in time, the title of psychologist isn't regulated, but we're in the throes of sorting all of that out because there are many different types of psychologists doing many different things.
Great. Perfect. Valerie, we're going to come back to you again, and I'm going to introduce Cillian Custy. How are you today, Cillian?
Good now. Good morning, everyone.
Great. Would you like to introduce yourself formally and just give us a bit of an overview on your job role?
Absolutely. So my name is Cillian Custy, and I'm a community dietitian working in Ennis. And I suppose I'm working with people who are living in larger bodies, who are trying to manage their weight, who are living with type 2 diabetes, and who are living with pre-diabetes. And I would work with them closely with lifestyle interventions in a one-to-one setting, but also I would deliver group programs to people with those conditions as well.
Great. And as a dietitian, you can work in several areas. As a career journey, did you start off in this area, or is it something that you've graduated into over time?
Yes, I suppose I originally studied sports and exercise science in UL, and I kind of really liked the aspect of how lifestyle changes could improve your health. So then I decided to stay on and do dietetics in the University of Limerick. After that, I started out in the hospital, and here I worked on several medical wards, I suppose, helping people who are losing weight due to different health conditions. Then I decided I wanted to try something else, so I moved to the community and kind of help with lifestyle interventions to improve health and health conditions.
Oh, great. Thank you very much, Killian. Una, I'm going to come back to you if that's okay. Una, can you describe your education journey to becoming a speech and language therapist?
Yeah, sure, Verity. So, as I said already, I wasn't sure what I wanted to do when I picked my Leaving Cert subjects. So I hedged my bets and picked a science subject, which was chemistry, and a business subject, which was economics. And I knew while that wouldn't get me into everything, it would allow me lots of choices. And I had a second language as well. So then I did decide to apply for speech and language therapy sometime later when I was making my CAO choices. And there was only one place at the time to do speech and language, and that was in Dublin. There's many more options now in Ireland. There's courses in speech and language in Cork, Limerick and Galway. At the time it was only in Dublin, and we do hear of people going, of course, to Scotland and the UK as well. You can also do a postgrad in speech and language therapy in the University of Limerick if you choose to do another degree first. I went straight away into it, and after that, since graduating, there's lots of educational opportunities to expand in your area of clinical interest. So I've done lots of courses and continuous CPD activities, including one area I did was a higher diploma in education, teaching and research when I was working in the University of Limerick.
Oh, great. Thank you very much, Una. Everyone in the audience, students, we're getting some fantastic questions come through, so please keep them coming. Claire, I've got one for you. What subjects would you recommend someone that wants to study physio complete?
Yeah, I think biology is probably one of the most useful ones. I did chemistry and biology because at the time, some of the courses required 2 science subjects. But I have many friends who came into physio from all sorts of pathways. I didn't get the points initially. I did sports science and sport rehabilitation in the UK for 3 years, and I had the best 3 years of my life. Then worked as a therapy assistant, and then came back to the Royal College of Surgeons and did physio in 3 years. So subjects, yeah, biology was useful, definitely. After that, I really don't think, you're taught everything you need to know really on the course. Even if you didn't do, well, I think probably, yeah, biology would be useful. And a lot of people in my course had just done a science degree and then came and did physio as a second degree after they did some science-based degree.
Great. Yeah. Thank you so much, Claire. Aoife, we've just had one come through as well. So what kind of challenges do you face every day in your job as a social worker?
Yeah, that's a very good question. Sometimes people feel, oh, social work, like why would I need a social worker? Why would the social worker be coming to visit me? So firstly, I suppose the key thing for me is I don't visit anybody or call to anybody or work with anybody unless they want me to be there. So only if they want me and they're consenting to me coming.
Yes.
So I suppose firstly it's about explaining what I do. My role is purely about supporting and helping and acting as like an advocate for people, I suppose, to help them to be able to voice what their own, wishes are for what the way they want to live their life. Some people might find that they're very, that they might be unwise decisions, but they're their decisions to make. We're very clued into that now in healthcare in terms of people's ability to make their own decisions and how important that is. So I suppose sometimes the challenges can come from other services as well that you're working with, because they may not be understanding, why the person is saying that this is what they want, or they might be disagreeing with that. So you're trying to help the person to represent themselves. I suppose that can be a challenge too, but it's one I suppose I love that part of my job. Another challenge is definitely, trying to get services on board for people. We all know that there's a housing crisis. There's a lot of people in homelessness or facing homelessness. I work with people like that in my role in primary care as well. People who might feel like they're heading towards that kind of that I suppose that trajectory of maybe ending out struggling to keep their house. So I suppose a lot of what I do is advocate again with different services. Like the council, or trying to get different services on board, maybe mental health services or various different types of agencies or support services. So that can be a challenge as well. But again,
I can imagine.
It's important to be, I suppose, a strong communicator as a social worker. It's really important that you're able to build relationships with people around you, because when you have those relationships, you can quite easily tap back into them again the next time you're coming for somebody, or when you want to come at a problem or an issue. It's very important to have those good networks around you, and that you network well with people and that you communicate well. So that would be
Absolutely. And being
challenging.
part of a primary care kind of team, you have the support of your multidisciplinary team to kind of,
Absolutely.
support you through
Yep.
those difficulties. So that's great.
Absolutely.
Thank you so much, Aoife. Anna,
you.
we're going to come back to you.
Hello.
Hi, Anna, could you talk us through kind of a day in the life of a medical scientist? So what do you kind of do when you come in during the day? Do you work night shift? If you can give us a bit of an overview of a day and then maybe a week in the life of a medical scientist.
Of course. So as part of blood transfusion, I suppose we closely work with the Irish Blood Transfusion Service in managing our blood stock and our red cells, our platelets, etc. So we also work with our analyzers, running our internal quality control, etc. So I mentioned before, we also work in partnership with different clinicians and nurses and providing those results for them so that they can take care of the patient. I suppose other than generic testing, we have different roles. So this year I'm Deputy of Equipment, Health and Safety Officer, and continuing professional development is something that is very much encouraged in our profession as a medical scientist. Weekly, I suppose the job is very flexible. We do have different shifts. There is an on-call service. We do provide a 24-hour 7 service. So we cater for many different types of patients. So cancer patients, maternity, newborns, and surgical patients, as well as an emergency service. So anyone that comes in, say, from a road traffic accident, any of those kind of scenarios.
Okay. And would you be on call like every week, every second week, or do you do a lot of after hours kind of shifts?
It really depends. So we do have a rota and you can swap in and out of the rota. It also depends on the discipline you work in. So there's biochemistry, hematology, histology, micro, and serology. Some do have an on-call service, some don't. So in blood transfusion, we have to. So it really just depends on the rota and how it's made out. It can be every 2 weeks or it could be every week. It also depends on the number of staff that's available.
Fabulous. Thank you very much, Anna. So, John, we've had a couple of questions come through and there seems to be a theme. So people that are interested in nursing but kind of are a bit skeptical or are kind of wondering if they would be able to deal with the loss of patients. Can you talk us through that? So how maybe you cope with a loss of a patient and what kind of personality traits you would have to be able to handle that maybe seems to be the theme on the Q&A.
That's a terribly good question. And it's an undeniable part of nursing, of healthcare work that one will be present for the passing of a patient, somebody that dies. Dying is a natural part of living. It's something that none of us will escape at some point. How do I cope with it? I've held the hands of people as they passed. I've hugged, I've given solace, I hope to think, to family members after the loss of a loved one. It is tough. There's no point sugarcoating it. It is tough, and it is something that one learns to cope with. Everybody's different. Everybody has a different coping mechanism. I go home myself and I embrace my family. I embrace who's at home with me. I enjoy being present with them once I've experienced something like that with a patient in the hospital. But again, everybody's different coping mechanisms will vary wildly from person to person. It might be a walk in the forest. It might be a walk up the road, just to clear your head. It might be, a good workout session in a gym or something. But it is something that you do have to learn to cope with, but everybody does in my profession. Yeah.
That's really good advice. So I think what I'm taking out is that there shouldn't be any qualities that you identify now that you can't handle that. It's that you learn to cope with it maybe, and the support. Do you get a lot of support from, obviously, I could imagine the team and wider team, that kind of thing?
I could answer a couple of questions actually that have been asked already in answering that question. You'd be asking what supports are there within nursing. You're asking what subjects you did in the Leaving Cert that would help you. Nursing as a profession, the nursing studies course in UL and all across the country really does build you up to be a healthcare professional that's able to deal with virtually any scenario that presents itself in a hospital, in a community setting, in any healthcare setting as a nurse. Yeah.
Okay, thanks so much, John. We'll hopefully come back. So we've got a couple here. So Dr. Valerie Switzer, how are you again? So I've got one question here from Thomas just saying, what did you do for your doctorate is one question. And could you just answer maybe what kind of qualities you think would be necessary to become a clinical psychologist?
Okay, so let's start with the doctorate question. So just to explain that when you train as a clinical psychologist, you do a 3-year university-based practitioner doctorate. So that is comprised of typically six-month clinical placements where you work under the supervision of a senior clinical psychologist. And you also then do pieces of research. So you do a service-based research project, and then you do a doctoral dissertation. So I'm not sure if that's answering Thomas's question, but specifically say the dissertation that I would have chosen was to look at how children who had been adopted into Ireland from Romania were doing. So there was a large number of children adopted into Ireland from Romania during the 1990s. And I had the opportunity to do a piece of research with that group when I was completing my doctorate. So that's the first question. The second was the qualities, is that right?
Yes, that's right.
Quality for clinical psychology.
Yes.
So I suppose I would say, first of all, you need to be curious about what it is to be human, and you need to like being around people and be emotionally attuned to them without getting emotionally involved. So there's a fine balance in that. And I suppose a little bit like what John was saying about the training, when you go through your training as a clinical psychologist, you learn how to manage that.
Yes, yes.
The second quality, and Aoife touched on this, is you need to be a good communicator. So you need to be a good listener, a good speaker, a good writer, a good negotiator, facilitator, and I suppose, reasonably able academically. And I would say maybe the last one would be, there's very little black and white in psychology. We do a lot of work in the grey, so you need to be comfortable with sort of ambiguity or uncertainty. And you don't always get the results that you're looking for, because usually the situations are complex and psychology might be only one factor. So you have to be able to manage disappointment as well.
Yeah, I can imagine that. Okay, thank you very much. And anyone interested in meeting Valerie or interested in clinical psychology, we are having our UL Open Day Health Speaker Series next Thursday and Friday on campus in UL. You'll find us in the main building, C block, and we're lucky enough to have Valerie speaking with us on the second day. So thank you very much, Valerie. So Killian, can we just come to you, and would you be able to explain to us what subjects did you find helpful in studying dietetics?
Absolutely. I suppose what subjects would be helpful is chemistry, and that's a requirement for the undergrad course in Dublin. So that's definitely something. And biology would also be very helpful. And I imagine, and I didn't do it myself, but the new PE course would be very relevant as well.
Okay,
chemistry
great.
would be the priority.
Great. And would you be able to give us a day in the life of a dietitian?
Absolutely. I can give a day in the life of myself at the moment.
Absolutely.
So I suppose I work from 8:30 to 4, Monday to Friday. Generally in the mornings, I will organize the files for the day and I review the patients that are coming in to see me. I might see 4 to 5 patients in a day, and that could be, for example, someone who's newly diagnosed with type 2 diabetes in the morning, and they're looking for education about what diabetes is, and we'll talk about how, I suppose, food can fit in there.
Mm-hmm.
Another patient could be someone maybe who's trying to lose weight to help manage their high blood pressure. That could be another reason. I might have someone who's been diagnosed with pre-diabetes for quite a time, and it's something that they're working on trying to reverse. So I could be supporting them in that sense. And then as the day goes on, I'll write up my notes, I'll send letters to GPs and other health professionals as needed.
Okay, fabulous. So we have a question come in here. So hi, Killian, what qualities are necessary to become a dietitian?
Qualities, the main one would be, I suppose, communication and people skills. You're working very closely with people. You could be having a consult for over 45 minutes, and then you're working closely with healthcare professionals. Other things that are really important, I suppose, are time management, empathy, understanding, listening skills, and planning and organization are always good for healthcare roles as well.
Fabulous. Okay. And if we can just go to Anna, we've had some questions come in here, Anna. Just so what course did you complete to become a medical scientist?
I personally decided to pursue biomedical science in MTU and UCC. So that course is offered jointly. So basically at the end of 4 years, you spend an equal amount of time between the two universities. But it's important to note that to be able to work as a medical scientist in Ireland, only 3 courses in Ireland can qualify you to work as one. So MTU UCC, also the biomedical sciences course in ATU and TUD. And it's just allowing you to gain those, I suppose, placement hours and then become a CORI registered medical scientist.
Okay, perfect. Thank you very much. We've had 2 questions come in for physiotherapy. So Claire, can you describe a typical day in the life of a physiotherapist?
Well, I can describe my current day. Like it's every physio might have a different role and different hours and things. I work 8:30 to 4, and I do work a Monday, Tuesday, and a Thursday and a Friday, Wednesday off. A day in the life, it'd be something like Killian's probably coming into the office, checking emails, have a quick meeting with the other physio and OT and physios in our team. I would be ringing people, making appointments, pulling out files, seeing who I need to get to. Then I would be going out on home visits mostly and assessing people. So it could be people who've had a hip fracture and are recovering from hip surgery, or any kind of medical condition where they're deconditioned or off their baseline. Go out, do exercise programs maybe in the home, falls assessments, practice with mobility aids. Could be practicing the stairs, bringing them outside to practice outdoor mobility. What else was I doing? Then linking in with lots of people on the team, and sending letters, communicating, making lots of phone calls and emails.
Yes, yeah.
And it's very varied. Then it's completely different if you're in a hospital setting, really, as well. But that would be me at the moment. But yeah, hospital, you'd be going in and you'd be, going up on a ward or doing something like that. Yeah.
Great. And we just have one more question for you, Claire. So, hi, Claire. Do you work with people and working in a rehab setting?
Well, I am work. I suppose what we're doing is rehabbing people in their homes at the moment. This role, but I have in the past worked in different various settings where we would have been doing inpatient rehab.
Yes.
In a gym or
okay.
Yeah, lots of different gyms in hospitals, gyms in community hospitals. Primary care, you'd sometimes be bringing people in and rehabbing them.
Okay, great. Thank you so much, Claire. Aoife, we're just going to come to you. So what would be the best advice that you could give someone considering a career in social work?
Mm-hmm. Yeah, I think the most important thing you need to think about, I suppose, is that, it can be a challenging job in lots of ways because you're dealing with lots of problems a lot of the time. But I suppose you need to have a positive spin on that and be able to, I suppose, be a good problem solver. Thinking creatively. And I suppose that's what I most love about my role in primary care, that there's great scope of work. I deal with a huge variety of different types of issues and different types of problems, but being able to think, outside the box sometimes and having to go, in different directions at something with the patient, with the service user. So I suppose, being flexible in your thinking is really important as well.
Yes.
Like as Valerie spoke about, seeing the grey, we're working in the grey so much of the time. Things are never black and white for people. Really being able to listen to what the person wants, I suppose, and trying to support that as best you can. So, I suppose flexibility, kind of creativity in your thinking, being a good communicator, and being able to put yourself in other people's shoes is absolutely key. I think they're probably very important characteristics, really, for social work.
Yep.
Yeah,
I can imagine. Yep. Thank you so much, Aoife. Anna, we've just got one question here. So, was the leaving cert or your college course harder?
I'd say the college course was slightly more difficult because you really get to expand on your knowledge. But as many of you have said, a science subject is relevant or recommended. In first year, it's all revised. So if you didn't sit chemistry or physics, all of the majority of the material is revised, so there's nothing to worry about.
Okay, that's good to know. Thank you very much, Anna. And John, we're going to come back to you. We've only got another minute left. So John, so in regards, we've got a question here about nursing. So as a general nurse, when you start and you've finished your degree and you're going into the hospital setting, what kind of after hours kind of on call or after hours like roster would be in place for someone that's newly starting out? Just an indication.
Yeah, the vast majority of settings for a newly qualified staff nurse. Now, those newly qualified staff nurses would have gone through a 4-year degree course anyway in UL with various clinical placements around the hospitals in our area. So they would have been well exposed to what happens and would probably know at this point what faces them. But for you guys at home or in school right now, it would be pretty much 12-hour shifts, by day or by night as a newly qualified staff nurse. As you move along through your career, you may specialise one way or another way through your nursing. Depends on what course of career path within nursing you take, and some of those roles they might evolve to a Monday to Friday, 8 to 4, 7 to 4. Different. It varies widely, but really, bottom line, when you qualify, you're more than likely, in the vast majority of cases, going to be doing 12-hour shifts or thereabouts. Yeah.
But it doesn't have to last. That's good to know. Everybody on the screen, I can't thank you enough for all your time and expertise today. That was a fantastic session. The 45 minutes just flew. Please stay around. The questions seem to be just keep coming in. If you've got 5 minutes, please, we need to answer all of them before we go today. But just thank you very much for your time today, and you'll definitely be invited again next time. Thank you very much. Great. And I'm very happy to introduce one of my colleagues and friends, so Maura Fitzgerald. And Maura Fitzgerald is a Nurse Education and Integration Manager. So hi, Maura, how are you today?
All right, I'm very well, Verity. So, and thank you very much for your session.
Thank you. I'll hand over to you, Maura. Have a great day.
Thank you very much. So I would like to welcome our two next presenters. Our first presenter will be Billy Woods, who is the Finance Manager with UL Hospital Group. And our second presenter will be Maria Quirk, who's General Manager for Operational Services here in UHL Group of Hospitals. So welcome to both Billy and to Maria. So first of all, I think we'd like to start with Billy's presentation that he has there ready for us and working in with in his career journey to date. So I'll hand you over now to Billy. Thank you, Billy.
Thanks, Maura. Good morning, everybody. So my name is Billy Woods, and I'm a finance manager with the UL Hospital Group. So just an introduction to the finance manager's role. I have responsibility for giving financial guidance and advice to our business management teams. And the total budget for the year for the University Hospital Group is 525 million for this year. And as part of the role, then, we have to ensure compliance with national financial regulations, ensuring that we are following set rules and regulations around the spend of public monies. And I'd also then be involved with any new system developments and upgrades. So through designing, building, and testing these developments, and then ultimately the deployment of the new systems and upgrades to the services. Also then be responsible for the financial planning of new hospital developments and services, such as costings, getting the sources of funding, and monitoring the spend on these new developments. And then we would also be interacting with our other stakeholders. So the patients who use our services, the staff in the different service areas, our suppliers who supply us with our goods and services and consumables, and then other government departments and public representatives. So my education journey, I went to St. Brendan's Primary School in Borough County Offaly and onto a community school there. And I suppose my journey hasn't been your traditional one, that when I finished the Leaving Cert, I went to college, done a course, but a couple of years into that course, I found that it wasn't really for me. And I ended up dropping out and taking a job in the company's registrations office, and was there from 2001 until 2008 when I joined the health service. And when I joined the health service, I found that the learning and development programs that were available to me enabled me to go back and do other courses in different colleges, such as TUS and UL, where I've done courses, I've diplomas in public procurement, in payroll management, and ultimately in accounting and finance. But as part of my journey through the health service, then I worked closely with colleagues in IBM and Novitas, who are external partners, and ultimately through our SAP systems, which is our finance, procurement, and our HR system. But we also have an online learning tool in HSE land, which the HSE have developed, that has a number of courses that our staff can sit and help bring about improvements at all times. As I say, learning never stops throughout your career journey. So on top of my role in the hospital, I would also have a number of volunteer roles. So within the hospital itself, I act as a support contact person. So with that role, I'm available to provide information and support to colleagues who may be having difficulties at work, or in some cases outside of work. And I can sit down and have a chat with them and give advice. I'm also involved with a number of my local sports clubs, so working on committees or training youngsters, and you see some of the badges there. I mean, the Borgia Club, Highfield United Football Club that I played for, and over the last few years I've become heavily involved in tennis, the Roscrea Tennis Club, Wilmer Tennis Club, and the Midland Tennis League. And then I'm also involved in a number of committees within the hospital group, such as the Sports and Social Club and complaints committees. And the outcomes of these volunteer roles, it's important to working with teams. It helps to develop new skills, and throughout any career, you'll find teamwork is one of the most important skills that you would need to develop. But also these volunteer roles will help to develop an experience that you can include on your CV. So, sorry. There's a huge variety of finance roles. Anybody that goes into the finance within healthcare or any finance role, you have your management and financial accounting, business analyst roles, auditors, finance systems and database specialists, or just finance specialists in general, which would be payroll, accounts payable, or taxation. And finance transcends all industries. Examples for me, if you have a career in finance, you could work in retail banking, the energy sector, IT, gaming, or healthcare. And through any of these, you can move around and learn new skills and find out which industry is right for you. So the typical day for finance, for my role within finance, I would come in the morning, review my emails and respond to requests for financial information from the services, attend meetings to make important decisions for the hospital group, review and report on the monthly income and expenditure for the group, have regular meetings and discussions with the senior managers about the latest financial performances of their departments, and assist senior managers with preparing costings for business cases that aim to develop improved services for their patients. And then I would also meet with other finance staff to find solutions to issues that arise on a daily basis. So again, your problem solving skills. And within finance and throughout the University of Limerick Hospital Group, we were always looking for opportunities to improve patient experiences through the better use of the financial resources that we have. So the important traits for a finance professional is, first and foremost, in any profession, is honesty and integrity. And then self-confidence. Don't hide away, always be prepared to put your hand up and don't be afraid to make mistakes. And if you're a good communicator and focused and dedicated, you will always go a long way.
If I can move on now to Maria Quirk, who is our operational general manager services here in UL Hospital Group. Thank you, Billy, and welcome, Maria.
No, my apologies. How are you, Maura, today?
Very well, thanks, Maria. So welcome, and we look forward to hearing your presentation.
Yeah, and thank you for the opportunity, and just welcome to everybody who's there today. So I'm going to start off my presentation. So Kate Mila Fudge, Prosperous Health Science Academy student, you're very, very welcome today. And albeit I can't see you, you are very, very welcome. My name is Maria Quirk, and my role is General Manager, Operational Services to UL Hospitals, which encompasses the 5 hospitals within the group. So I don't know if we've any Marty McFly fans here online today, but we're going to do a little bit of back to the future. So I set my Leaving Cert in 1998, and the elective I chose at that time for my Leaving Cert were agricultural science, geography and business studies. So I suppose I was a little bit like Billy. I didn't really know what I wanted to be when I grow up, and I suppose I still say to the staff here, I still don't know what I want to be, because I suppose it's quite a variety working in the health service, and what your job is today from a business acumen perspective may not be your job in 5 or 10 years' time. And I'll just take you through a little bit of that as we go along. And I suppose my academic journey was, I did do my Leaving Cert, and I did a diploma in Office Information Systems. And leading on from there, we have a fantastic learning development unit here in UL Hospitals, and I couldn't describe the unequivocal support I've had over the years from that department. I participated in a certificate in healthcare management in the University of Limerick, and it was my first time going to the University of Limerick to do a course in 2019, participated in the HDIP in Business Practice Management in 2020, and concurrently I participated in a HDIP in Patient Safety in 2020 at the same time. And I did and finalised my BA and graduated in 2021 with an honours BA in Business Practice Management. And I'm currently undertaking an executive MBA, and that concludes in 2026. So I might be as fresh looking more when I finish the MBA in 2026. I suppose my career journey is varied, and I'm just going to hit on a few of them, because I suppose the real point I want to get across today is the variety of opportunities that the health service offers. So you can see I worked, and I suppose it had nothing got to do with any of the study I did as an assistant manager in EB software. And I suppose if there's one thing that I could get across, when I was in secondary school, I organised the graduation, I organised the DEDs, I was the captain of the sports teams. So I suppose from an early age, those leadership and planning organisation qualities were there, albeit the mindset of what I wanted to be when I got older wasn't there. And you can see I worked with Superquin there as a fresh food manager, entered into the health service then in 2004, it's 20 years ago now. Had a variety of roles, FAC project office, worked in cancer services as an administrator. I was in finance for a period of time, albeit I didn't work with Billy. Business support manager. You can see now the whole managerial piece is starting to ramp up a little bit there in 2017. My studies would have hit at the same time. Business manager maternal and child in 2018, business manager perioperative care in 2020. And then I took on the surgical access manager role, and I became a general manager in 2023. So I suppose if I could give one selling point, it was when the academia hit in 2019 that the skill set and the understanding of the business acumen was really, really bolstered. And that was all supported by UL Hospital. So there's heavy investment there in employees within the group. And I suppose that all leads into succession planning as well. So I suppose to anyone thinking of studying business studies, or I suppose you could study anything, and it's really about how you progress within an organisation yourself, or how you actually want to progress within an organisation. A day in the life of an operational manager, there's a lot of variety there. There's a number of hospitals, and my remit has a headcount there of between external contracts and internal people of 1,200 personnel. The areas just across the group, they're like, I look after everything from car parking to security to clinical engineering, catering production, frontline portering services, the hygiene services, health and well-being, and I chair a number of committees there and have a number of responsibilities. Operation services, it doesn't stop on a Friday evening, and it doesn't stop on Christmas Day. It's a 24/7 service with service managers operating over 365 days a year. And all departments within the hospital are dependent on operation services to progress with their daily activities. It's quick paced, it's vibrant, it's diverse. I have never woken up any morning and said, God, I really am not looking forward to going to work today. I've always bounced out the door. I'm proud of what I do, and I'm really, really proud of my academic and professional achievements to date. And I suppose that's a testament to both me as a person and my resilience, and I suppose the organisation as well for supporting me and believing in me. So patient safety is a key component of supporting patient care, and it really supports any decision I make as a general manager. It's the one key component that stops me in my track. Are my patients safe, and what can I do to ensure the patients are safe? So that's a brief overview of what I do, without getting into the nuts and bolts of it, Maura.
Thank you very much, Maria, for that insightful experiences that you have in your career to date. So it has been, you've worked in previous areas not related to, with say, healthcare. So what really prompted you to join the healthcare team?
Is that for me, Maura, is it?
Yes, yes,
Yeah,
yes, Maria.
I suppose it was an opportunity. Like if I built a house when I was I'd say I was 22 when I built my house, so I was very, very young. I built on the family farm, and I'd been working about 80 hours a week between Dublin and Limerick, and I had a lot of travel to the UK, and I had saved, I think it was about 80,000 euros at the time, and I had furnished the whole house after I built it. So I kind of said, like, I wanted a Monday to Friday job. I wanted something a little bit different. I had done the office course, and that's really what prompted me to work in the health board. And I suppose when I had been younger as well, when I had done the office information systems course, I had worked during the summer periods in foster and adoption, just doing a little bit of admin work, and in community care in Unit 3 as well. So it was kind of like a natural kind of a grow to the health service and such.
Okay. So you have a lot of, with a variety in your current role. So can you tell the TY students, what is the biggest challenge that faces you every day?
So the biggest challenge that faces me every day, Maura, is when I wake up, and I'm usually up at 5:30 every morning, and I have been known to be here at 5 and 6 in the morning walking the floor. But the biggest challenge I would have is when I plan my day, it never works out like that, because you can have anything from an emergency that would come on board, to an urgent meeting that needs to take place, to a different scenario that might happen. And you need to be able to be diversify with the competing needs of the organisation at that time. A lot of critical analysis and decision making, but what I would say is 20 years working in the health service and the academia, it all helps you in making the right decision and putting the patient at the forefront of everything we do, Maura.
And would time management be very important in your daily role?
Yeah, time management is important, but I suppose what you need to do is you need to prioritise what is the competing priority at the time.
And what do you enjoy most in your day-to-day work?
People. I love people. Yeah. And I love seeing patients leaving the hospital and having had fantastic care, being returned to their loved ones, and be able to continue on with their lives a lot better than what they came into hospital with. So it's that, I suppose, that caring instinct as such, Maura.
Okay. And one question that's coming in now in our question and answer session is, what hobbies have you after a busy day?
Oh my God. So I played camogie for years, and I had to stop playing camogie when I was about, I'd say 36. I ended up having to get back surgery, and I played basketball for years as well. I have 5 children. My eldest son graduated there a few weeks ago. He's a chemical engineer. He's starting work next Monday, and I have another lad who's doing law and accounting, and my next lady's in the tutorial. I'm not too sure if they're tuned in today, and the small ones are in primary school, but I do a lot of hill walking at the moment. I did a fundraiser there for Milford at the start of the year as well. So a lot of hill walking, and I love camogie, rugby, and loved basketball over the years as well.
Well, thank you, Maria. And Maria, Billy, now would like to ask you some questions that are coming in here, Billy. Anybody who is considering, with a career in finance, what subjects would you recommend them to study?
I suppose for the evening cert, any of the business orientated subjects, which is accounting, economics, biz org, would be helpful. They're not subjects that I've done myself. As I said, I came to this a bit later in my life, but as you go on to college, then courses that would be helpful would be, again, any of the accounting, business or finance courses would be hugely helpful in the finance role.
And with what do you like most about your current role?
Well, within my current role, it's just I have a huge variety. So whether that's dealing with the services and assisting general managers such as Maria with maybe new tenders to business, or trying to introduce a new finance and procurement system, which we're doing at the moment. I never have 2 days the same.
And what is your role in with, say, introducing the new system?
So I am what's called a O2C lead analyst, or order to cash. So I'm responsible for leading out the introduction of the new system for our income services across the hospital group and the community across the Midwest.
Okay, I'd like to thank Maria and Billy at this point, and I would now like to welcome Katrina Tierney, who will be sharing the next session. And thank you, Katrina.
Thank you so much, Maura. That was brilliant. I was tuning in for all of that, as I was on Tuesday. Good afternoon, I suppose, at this stage, to all our students, parents and guardians. My name is Katrina Tierney, and I've been delighted to be a part of this every year. I'm a journalist and broadcaster, but I work in the communications office with Limerick and Clare Education and Training Board, who are delighted every year to be a support on this. And I suppose I love this. When I was your age and talking to the students now, I had no clue what I wanted to do. I think I watched a lot of LA Law, and I thought I wanted to be a solicitor at the time, ended up being a journalist. And that's why I love this, because it gives you an insight and inspires you on the many careers that are available in healthcare. And with that in mind, I have some students to introduce to you that we're going to be chatting with. So we do have Niall Duffy, who's a physiotherapy student, who's going to be chatting with us today. We also have Ellen Garcia-Breen, who's a nursing student. Also Lydia French, our dietetics student, so they're joining us now. And Ashlyn Porter, who's in speech, language and therapy. So if these are areas that you've ever wondered about, it's lovely to talk to people who are in the industry, but it's very, very important to talk to students who are studying right now, because do you want to stay in this? Do you want to pivot to another area in healthcare? That's what we'll be exploring now over the next few minutes. So do join us, sit back and enjoy. So we're going to start with Niall. Good morning or good afternoon, Niall. How are you?
Hi, how are you? Good now.
Delighted to have you on board, Niall. Is this your first time here on this kind of a platform with something like this? You'd be aware of it before?
Yeah, so this is my first time talking to something like this. I've gone back to my own school before talking about my course, but never anything like this now, no.
Fantastic. Well, we're delighted to have you, and we are inspiring others. And as I said there, Niall, I hadn't a clue what I wanted to do when I was at a student, and it was probably the hardest thing. It's like that Instagram life where people think, oh, everyone else knows exactly what they're going to be, and you're kind of thinking the pressure. Was that the same with you, Niall, or did you always know that you were going to get into physiotherapy?
I suppose I was lucky enough that I knew, I'd say from around TY or fifth year, that I wanted to do physio. So when I was in TY, I kind of took that chance. I had cousins that were doing it and had a chance to go in with them and shadowing a few of them, seeing what they were doing. And I just loved it from the start. So I was very lucky that way. And never really looked back since that. I was kind of getting into physio in some sort of shape or form, whether it was through a different course and doing a master's or getting into the undergrad. It was something I was fairly set on, yeah.
Now, so you were set on it and you obviously had a lot of experience with people who were involved with it. Was there any preconceptions going into it? Because I know myself, you know, when you go into an area and think, oh, it's going to be like this, and then it turns out to be totally different. So was there any misconceptions in physiotherapy? You thought, oh, this is totally different?
Yeah, I definitely, physio is a big one. I think that as soon as you mention physiotherapy, people think kind of sport, massage, that kind of thing. And I've learned since starting college, it is very, very different. There's so many different things you can go into. That like I didn't even know this before starting college, that there's like neurological physiotherapy, so that's working with kind of stroke patients and kind of conditions related to brain, Parkinson's as well, things like that, and respiratory as well, so working with lung conditions, which I wouldn't have known was part of physio at all. So even after starting, so I'm in third year now, that there's so many different areas we covered that I didn't realize was part of physio. And like you said, with the preconceptions, like our first day, we had an icebreaker and we had to say like our name, where we're from and why we got into it. And I think it was 27 or 8 out of the 30 said I'm had interest in sport, and that's why I got into physio. So it's funny, yeah.
Yeah, so that's an area you would like to pursue? Is it the sporting side, or what are you thinking yourself?
Yeah, so like that's initially why I got into it, and now after having my first placement and seeing all the different areas, I'm actually looking at a very different route. I actually have a huge interest in the neurological side now.
Okay.
Yeah, and my first placement was a pediatric neurological placement in Limerick, and I loved it. Found it very interesting, and I think that's something I could look into in the future now. Yeah.
Wow. Well, Niall, you've impressed me there. I would never have even thought of that. So there you go. And that's what it shows everyone. It's the preconceptions we have, and then to be able to talk to you guys and hear a little bit more. Niall, we're going to ask people to put questions in. So if we get some questions, we'll be back to you. We're going to move to Ellen. Ellen Garcia-Breen, you are our nursing student. Welcome.
Hi, how are you? Nice to meet you.
Thank you so much for joining. So I suppose I'll start with that as well. Is this an area you always knew? Did you always have a passion for nursing? Or was there another area you were thinking of, or how did you get into this?
I suppose I've always been quite an emotional and empathetic person, and I feel like I've always wanted to work with people, and kind of like I love talking to people. You will not be able to shut me up if you get me started. So I feel like I always knew that I kind of had that kind of caring, empathetic side, but I think I also, like, my favorite subjects in school would have been science and biology. I always found it so interesting to like see what was going on underneath and like why this happened and all of that. So I think the fact that I enjoyed it and found it so interesting, I thought I'd go into a career that kind of covered everything on a general basis, because I didn't know that I necessarily wanted to be a nurse or not. But the fact that general nursing like opens so many doors for you, like you don't have to work in a hospital, you don't have to work 12-hour shifts, you can work in a clinic, you can work out in the community. Like, I just wanted to do a general career that had both science and people. And then I can choose after the 4 years what route I want to take, because as a general degree, you get to experience like pediatrics, geriatrics, surgical theatre, and I'm in third year now, and even still I'm learning new things and new paths that I can take after I graduate. And I think that's part of placement. You kind of get to talk to people who have experienced the same kind of thing as you and gone through the same career, and they get to tell you, oh, this is what you can do, this is how you can get support, or this is the different paths you can take. Like, before I went on placement, I didn't know an orthopedic nurse was a thing. I thought it was just a general nurse, but you can do nursing in an orthopedic hospital and they will fund you to specialize and do your master's in orthopedic. And yeah, I just think it's a very broad career choice that you can make that can kind of take you any way.
Absolutely. And now that you're in it, and you said there you're in third year, what would you say are the challenges at the moment that you kind of thought, oh, this is actually a very difficult part, and I'm really going to have to, think about this. And what would you say is your favorite part so far in your studies?
So I think I'll start on a positive note. Like my favorite parts would probably be like it's a very rewarding career. Like we're getting to work with people and following through their whole journey of like coming in sick and then going home and getting to be in contact with their families and everything. I also think there's like great supports available through the university and the HSE in general. Like I feel like in placement you've got your clinical practice coordinator who comes and checks in that you're signing your book and have accomplished all your competencies. You also have like allocations office in the college that will help you get to placement, or if a certain place doesn't suit you or if you're not happy in a certain place, they will help you, because it is quite a hard and emotional career. But I feel like there are so many supports and so many people there to kind of have your back that it makes it that bit easier. I also like how it's broken up. Like it's not just theory and it's not just practice. I would be more of a hands-on person. I wouldn't be like book smart, as you could say. But I feel like you do need the theory to kind of get you through placement, because when you're looking at the board, you're like, oh my God, what are they talking about? And then you go to placement and you're like, oh, hey, that's what they're saying, And I also think that the best part is the fact that you get to experience all of the specialities. So as a general student, you get to do all the different, as I said earlier, geriatric, pediatric, surgical, and all that. I do think the challenges would probably be like balance and time management is key, but that just comes with experience. It's in any job or career. You just kind of need to prioritize. But I think that we have a module called practice placement, and they help you prioritize self-care and make sure that you're looking after yourself as well as other people. And of course, it's emotionally challenging when you're facing people who may not always get to go home or may not get the outcomes that you hoped for. But there's great supports there for people that you can rely on for help, or if you're struggling in any way.
Well, that's a really important message, especially today on World Health Day, Mental Health Day today. So really glad to hear that. And it sounds like all of you are exploring all the different areas, which was why we wanted to get you guys on here to just give a bit of inspiration to the students. I'm going to bring in our next guest, and that is Lydia French, who's our dietetics student. Hi, Lydia. So Lydia, we're talking.
Hi, Katrina. Nice to meet you.
Yeah, you too. We're talking here about different areas, and I suppose when Niall was saying there about the preconception about physiotherapy, I always think sport as well. And then when you're thinking nursing, I didn't realize until it was just pointed out there's so many different areas in nursing rather than just general nursing. So I suppose when it comes to dietetics, I had absolutely no clue what that was about until one of my daughters actually is celiac, and I realized how vital in any sort of chronic illnesses or any areas that need help, that how important dietetics is. But for other people like myself, that didn't know what it's about, it's not just about diet and nutrition for somebody maintaining weight, is it? There's so many other areas.
Yeah, completely. I think that is one of the biggest kind of misinformations out there. I think people, when they think of dietetics, they just think, oh, here's the dietitian here talking about what I eat or my food or, anything like that. But it's such an undercurrent of everything to do with like the hospital setting. So I suppose from my own experience, I'm a second year master's student. So I've had a few placements and, you really see the working. So, I've done placements in the catering teams in hospitals. So you're working with the ward staff, the catering staff, you're working with the dietitian, and you're just ensuring that the patient is getting the optimal nutrition that they require. And then on the other side, you might have a situation where you're on the wards yourselves and you're doing kind of the nutrition care process with the patient and you're talking to them about that. And like you said, celiac disease, that's an outpatient setting. You'll be working in the community, but it's also like the clinical setting where you're like talking with a patient who, they might have been brought in for something else, but, they're malnourished and they're losing weight and they can't keep their weight on, and it's helping them with that. Or even, serious issues, serious conditions, the ICU, so intensive care, patients come in with a trauma, and how can we support them in that early critical phase, you know, so that their body is recovering, and how can we ensure that their body recovers at the maximal rate. So nutrition really does underpin. That was something I had always kind of grown up with, this, you know, food is medicine. If your body's not being nourished, you can't heal and you can't fuel yourself to keep going. And you really see that in the hospital. I think the dietitian's role, you're constantly circulating, you're always walking around, you're always seeing different patients, you're on loads of different wards, from the elderly patients to the pediatric patients. It's a really kind of buzzing area to be involved with. So yeah.
It must be exciting as well, touching on there, say elderly patients or patients with chronic illness, say if they've lost their swallow, or it's just so rewarding to be able to help in those areas and how vital it is. But that obviously, we were talking about World Mental Health there. I mean, that would have an effect on you as well. So I'm sure, tell us a little bit about the challenges that you see in this area.
Yeah, absolutely. I suppose I'm kind of just getting my feet on the ground now, and you know, I've done a lot of my theory, and you learn all these things in theory, but definitely, you know, when you see it in reality and you are coming face to face with that patient, and it does strike home. You know, I suppose the biggest thing I take away is empathy, and it's meeting the patient where they are, and it's patient-centered care. And it can be very difficult. You know, sometimes I have gone home and, you know, I won't lie, I phoned my mom in the car and said it was a hard day, you know. But then you see, you know, if you've worked with a patient and you've gotten various teams, you know, like Ashlyn, the SLT, if you've worked with anyone, you know, and you're seeing that all of the interventions that you're doing have progressed, they've gained weight, they're living more independently, you know, the progress that patient making it's just so remarkable. You know, it could really kind of, you know, if they didn't receive that intervention, they could end up in the hospital setting. But, you know, the interventions that we're all doing, you know, the interdisciplinary team, you know, that can, you know, keep them living at home. And it's fantastic.
Yeah, so rewarding and making a difference. And I'm going to bring actually Ashlyn Portier in here, because Ashlyn, you're speech and language therapy student. So we were just talking there, even just bringing up about patients with, you know, swallowing difficulties and stuff like that. Again, you know, people, when you hear speech and language, you're like, oh, that's just about, you know, talking and pronunciation. But this is a vital position within the health community in areas like that, and exciting new treatments. And so it's a huge area. Tell us a little bit about it and how you got into it.
Yeah, so I mean, my journey to SLT has been a bit of a varied one. I actually, when I finished my leaving cert, I really had no idea what I wanted to do. I took a year and I did a PLC, and then I studied linguistics for my undergraduate, and then I actually spent the last 3 years teaching English in Spain. So, so it's been an interesting journey, but I'm actually a first-year master's student, so I'm currently on the kind of the road into my first placement. But yeah, even thinking about all the things that I've kind of learned so far on my journey about feeds and swallowing, it really is like a vital intervention that we really have to focus on as SLT practitioners. And obviously, Lydia mentioned multidisciplinary teams. You really are working with so many other professionals. When you're out on placement, and we're already preparing. Basically, from our first week, we were told that you will be working with other people. You are not an island, so it is very important.
Yeah, and I'm just thinking as I'm watching you all, and it's so inspiring, but I'm just thinking, like, as a patient, if it was me or somebody that presented and perhaps it was stroke or a heart attack or even an accident, I mean, I could get to see all of you in that area if you think of it, you know, because, you know, it would be the nursing, and then obviously might need physiotherapy, the dietitian, the speech therapist. So it really brings it all together. So I just want to ask each of you, Niall, attributes, somebody just messaged there saying, what kind of attributes for a physiotherapist would you need when it comes into a role like that, do you think?
I suppose that a big part of it is kind of building a relationship with the patients they're working with. So kind of interpersonal skills is a big one. That we actually worked a lot on that in first year. Like that was actually one of our main modules, communication, and learning to listen to patients and hear what they're saying, and you know, building a relationship with them that they want to work with you and you're working with them well. Another thing I would say from placement, that it's kind of like you nearly need to be kind of curious, if that makes sense, that you need to like want to know what's wrong, find out what's wrong, because it's not black and white. That like say people will be coming in and you're trying to figure out what's causing them problems, and it mightn't be obvious straight away, and you kind of need to work with them to figure it out. So that would be another thing, kind of persistent. And other than that, yeah, I'd say just the kind of interpersonal skills. It would be big enough for all of the healthcare.
Yeah, it seems to
courses,
me
I
you
suppose.
all have that. You all have
Yeah.
that down. Absolutely. And Aisling, speaking of communication, you're dealing with people from all age groups. So I would say from very, very young right up to the elderly. So I suppose you really need those skills of communication in that sense as well, don't you?
Yeah, exactly. Yeah, it's just vital just to have that interest in communicating with other people. And also just, I suppose it's important to realize that like a lot of health communication is actually not as clear as it might be when you're studying it. You are involved so much in acronyms and kind of health speak. So it's important to be able to communicate to the patient what's going on with their health plan and be able to communicate it in a really clear way. So that's something that I think a lot of us have probably had experience with and probably have, like, you know, our coordinators honored us a lot about being clear when we're communicating with our patients and with our colleagues as well.
Well, I think anyone would be, you guys are going to be fabulous in your life professionally, because you've got the empathy down, you've got the communication down, and you're here inspiring younger people and their parents and guardians who want to learn about this. And you were saying there about in-house. I suppose a lot of times with health and other industry areas, we assume everyone knows what a physiotherapist, what a nurse does, you know, speech and language, and also dietetics. So thank you so much, all of you, for coming on today and inspiring us. And if there's any questions that any of our students have, I'm sure there's plenty, do put those into the question and answer session there. But thank you to Niall and Ellen and Lydia and Aisling. I wish I could stay all day talking to you because you have been so inspiring, but thank you so much. We do appreciate you. Thank you.
Great. Thanks so much, Katrina. And we're just coming to the end of our session, everybody, for this morning. So our second early careers event of the week. So today we started out with our healthcare professionals, and really you got to experience and hear from a wide range of professionals about what their role is, their career journey, a day in the life. And I hope that you took away, I guess, some of the key pieces where, you know, that it's really diverse. Healthcare pops up in many shapes and guises, and there's roles for people across the range. So, and equally that, you know, entry isn't directly necessarily from school or your 625 points. There are lots and lots of ways to get into healthcare. We also then heard from our business colleagues and looking at a different side of healthcare that we might not think. And really our goal with that was to spark your curiosity, that whilst you might not have any interest maybe in working in healthcare, but you could be really interested in finance or operational services or maintenance, those kind of areas. And there's a really rich, diverse career that's available there. And certainly Maria and Billy illustrated that really, really well on how a career in the health service and healthcare can be progressive and diverse. And finally, as always, we have the stars of our show, the students this year from University of Limerick. And every year we know our students love hearing from the UL students, and it's just wonderful to hear people's journeys and where they've gotten to. And certainly the big things that jumped out for me were, you know, the variety of options. And whilst you might think you know what a role is, it's really when you get into college that you're really starting to experience and, you know, see all the diverse opportunities that are available. So thank you so much to our UL students. That was just absolutely brilliant to hear all of that. A couple of things as well, just before you all log off. When you log off, you'll be invited to do a couple of questions for feedback survey. I would really urge you to do that because it's based on your feedback is how we create this. This has evolved and developed over the last number of years. And indeed this year, this is our second time delivering this. So please do take a couple of seconds to give us your feedback. We will be at the open day next week with lots of familiar faces that you will have seen today and from Tuesday from health professionals, and also over in the health sciences building. You will hear about programs from course directors and get to meet some students. So come with your lists of questions, ask everything and anything that you need to do. The other thing, just to encourage you all as well, and this certainly came up loud and clear on our Tuesday session, so those that weren't there, it's about trying to get experience and exposure. You know, the importance of interpersonal interpersonal communication, being able to work with people is really important. So volunteer, work in a shop, work in a hotel, get to see what it's like to work with people, how you see people at different stages of their life. Everybody has a good day, everybody has a bad day, and to be able to work and support people around that. So without further ado, I would like to say thank you so very much. Check out our website, healthcareers.ie. Thank you to all the team MCs for today's sessions, to all our students and teachers who've joined and facilitated the session today to make it happen. And hopefully we'll get to meet some of you next week in UL, and you never know, maybe on the corridors of our hospitals and health services in the future. Thank you, everybody. Have a great day.